Healing with Human Connection, where we have encouraging conversations about tough topics such as substance abuse, drug addiction, and mental health issues for those in the Northwest Indiana area. Our hope is to share information that will guide you to resources that can help you change your life so that you can live the life you were meant to live. Check out our website, www.healingwithconnection.com, to find a full transcript of today's conversation, along with a list of any resources or links mentioned in this episode. Enjoy the show.
Hello everyone, welcome. I'm Jeanne Ann Cannon. You are with Healing with Human Connection, and our guest is Miss Beth Wrobel and Lisa Scheller, my partner in crime in the podcast world. So I am actually a therapist and certified life coach, specializing in relationship, couples counseling, and transitions. I do both in-person and online therapy and coaching. And Miss Lisa Scheller is a life and health coach, specializing individual and family coaching. And she and her husband have written a book.
Yeah, From Fear to Faith. Yeah, and it came out last July 2022. And since then, we have really seen a lot of people, thank you for talking about this, so now we can talk about that. And that's the, really the goal behind this podcast, is making sure that people understand that we know addiction is out there, we know mental health is out there, they go hand in hand, but no one should ever be afraid to get help. And there's so many resources today than ever before, and that's why, we want to get the word out and have people like Beth on to share what's going on in her world at HealthLink. So yeah, really excited. So
thanks, Lisa.
Yep.
And that is what our podcast is about. Both Lisa and I, and Beth and her work, passionate about people not staying stuck. Whatever emotional issue you have, whether it be serious or not so serious, or addiction issue, or someone you love, oftentimes.
Yeah.
And Lisa, that's a lot of what their book is about, From Fear to Faith, is about helping loved ones or someone you know. So today we are blessed to have Miss Beth Wrobel. She is the CEO of HealthLink, and of course many of you are familiar with HealthLink. And Beth has been with them 21 years. And we're very happy. Beth, really, thank you so much for taking the time.
Well, thank you guys for doing this in general and letting us talk about what we do. Because I think it's just part of the, I consider this all part of healthcare.
Yes.
And so we're just a little part of that healthcare system.
Yeah. Well, we've all been there, Lisa and I know for sure, when you have a family issue and it's just never getting solved, and where do you start to get for help? So HealthLink is, maybe just start a little bit, Beth, about yourself and how you have a very interesting background.
I have that. I like to say I'm re-engineering healthcare. My degree was in mechanical engineering, and I worked 22 years at NIPSCO, and had an opportunity because my father had terminal cancer and I was an only child, and NIPSCO was going through the merger, and my job was eliminated, and I took my severance. And it's probably, at the time, it was 56 weeks of pay, and it was probably the best 56 weeks I had. I spent time, I have 3 boys, and I got to kind of re-engineering my own life and stuff. So I was working on my MBA at Valparaiso University, and my business law professor, Beth Gingrich, said to me, do you know anybody who wants to run the health center? And I jokingly said, what's a health center? And she goes, I'll grade your midterm if you go down and look at this.
Oh, wow.
And so that's how we got started. I'm not sure they had a lot of applicants. They were just going from being a free clinic in the Hilltop area to becoming a state funded.
Wow.
When I was at NIPSCO, I ran a big Department of Energy federal program, and I thought healthcare, energy, they got to be the same, right? It's the federal government, right? Oh boy, did I learn. But I did learn, and I learned that healthcare is a process. It's a broken and it's a hard, we've talked about that, hard process to get through. And if we can create a primary care system that helps people, get the primary care, but also helps them go through the system and get them the other care they need, it's a win-win for everybody.
So can you explain that for people listening, Beth? We know what you're talking
Yes.
about. When you say, so HealthLink generally speaking, HealthLink is, I have a boo-boo, I'm going to a doctor.
Yeah,
But
well,
you're talking
a
big
big,
picture.
so, you know, that's part of the problem is if you got a boo-boo, but if you haven't gotten your mammogram or your stuff. So what we do, and we were started truly for the people, when I first started, we were like 80% uninsured. If you think back in the, you know, early 2000s, there wasn't, Medicaid had not been expanded. There wasn't the marketplace. So a lot of people were uninsured, and that's what we started as, you know. And so getting people, if we can get people the right primary care, and in primary care, I consider it medical, dental, behavioral health, you know, optometry, those things, if we can get it, we keep them out of the high cost of hospitalization.
Right.
No one wants to, and if, you know, I unfortunately a couple of years ago ended up getting pancreatitis, and I soon learned how complicated it was and how scary it is if you're in the hospital. Now, the hospitals do an amazing job, but keeping the people out that don't need to be in. And things like so what we do is we have all that under one roof. And we have, right now we have 14 different clinics across northern Indiana. So Lake, Porter, LaPorte. We have Michigan City, and we have LaPorte has their own. We have 5 in St. Joe County, and 1 in Stark County. And we have 2 school-based telehealth systems. So if we can work to do that and keep people healthy, it's better for everyone, you know, and stuff. So that's what we do. And I think the exciting thing that I like about what we do is we don't start with the patient will, you know, giving a patient a referral to, you know, to go get a scan when they don't have any money, they don't maybe have a phone to call, they don't have transportation. It's not going to work. Right. So we start with what we will do for the patient. We see where they have to go, and we help them. It's a big picture, and it's always moving, and it's always improving.
Well, and as we talked prior to getting on today, it's so scary for you, the listener, when you have a problem and you don't know which way to turn. So what you're saying, Beth, is that you come and see us, we'll help you find what you need.
Right. And so we have amazing primary care providers, but we also have all these we have behavioral health people on
site. Can you talk about what behavioral health is?
Okay, so in my mind, so behavioral health can be someone who is really mentally ill. They have some mental illness. Just like people get cancer, some people get mental illness. They get addictions. Their brain is wired and they get addicted and stuff. So we have people who can help them with that, you know, kind of, I would say more severe stuff. But I always joke, you know, I have a behavioral health person because I have problems losing weight. And it's because I have to change some behaviors so they can help me with goal setting. And so it's this large spectrum that it's just part of your primary care at HealthLink. So, and I think that's the problem. It bothers me. A lot of times people don't want to get help because there's that stigma. And when we start to move the stigma to, well, if your friend had cancer, would you go, don't go get help because that's a stigma? No, you're going to tell them to. And it's the same thing with any, you know, mental. I like to use the word behavioral because it's all, you know, I think it's a softer, and it describes more of what we do.
So if someone's out there and they have maybe depression or anxiety, and it can be any level, as you say, it can be mild or it can be, I can't get out of my house.
Right. And we see it all. And we've actually worked with people who are afraid to leave their house, where we have things through telehealth now. We have paramedicine. So again, it was what we found is some people, we said, well, we could set up a telehealth. Well, I don't have a laptop. I wouldn't know how to set it up. So we actually work within health, and they'll send a paramedic out. They have the computer. They'll set up, you know, we set the appointment. They can draw blood. They can take blood pressures.
So great.
They might check the refrigerator, make sure that person has food. Because whether, you know, if you're suffering from depression and you can't go to the grocery store and you can't get food, you're going to get sick.
Right.
Yes.
And so it's
They'll
that
multiply.
feeling, how do you pull these pieces together?
Mhm.
And the other thing I will say, has always been that we were for those people. We take anything from, we have a sliding fee for people who are really uninsured, but we're going to screen you because we can do amazing things for the uninsured. But as soon as you get that insurance card, whether it's Medicaid or Medicare or Marketplace, it's a lot easier to get care. But we will fight for them even if they're uninsured.
Right.
So we want people to come in and give us the opportunity to see what they might qualify. And people are blown away with what we're,
Able
not
to-
too many times in Indiana,
Yeah.
but that's
Sure.
the one good thing. We expanded Medicaid.
Yes.
And so a lot of people that before were not able to get those services, they can get it, and it's pretty reasonable cost.
And I think you hit on a good point, because that's what people are afraid of. I have no insurance. Who is going to give me help if I don't have any insurance? Because back in the day, it was like, you don't have insurance, it's going to be a tough road. And they're already feeling down and out, like it's a lost cause. So
Yeah.
for them, people to know that that's what you do, and just come see us, see what we can do for you. Get them pointed in the right direction.
I have a picture done, it probably was 15 years ago, of a lady. We had like a women's, we were trying to get people to get PAPs and mammograms, and we had like a women's tea. And she came and she said she was uninsured. And so I set her up with our nurse practitioner, and she knew. She was afraid that if she came in, she was pretty sure she had cervical cancer and that they had just bought a house and they would lose the house.
Oh.
Well, getting cancer in Indiana, especially if you're uninsured, not a good thing, but there are programs. So we got her on the program. And so she said that the day that she was having surgery down at IU, her daughter was with her, and she said, "Mom, you got to come through because you're going to have a baby. I'm going to have a baby. And I need the baby." And I'll never forget that. And so she did. She said she saw these while she was having surgery, all these little fairies. So she did a picture for me with a whole bunch of little fairies because we were her saving grace. So, and that's just one story
Yes,
of what
yes,
we've done.
right, yes.
And it's not me doing it. I have
A
500
community
employees.
of people,
It's a,
but they're all there to help and point in the right direction. I know I've been in HealthLink and just great service. I walk in there and like, can I help you?
Yeah.
Whatever it is,
I always say we may be, that's the one thing, during COVID, we did a lot of vaccines
Yes.
for people who were not our patients.
Mhm.
And I get these calls from pretty high people, and they go, "Your staff is so nice." And I go, "Well, they better be," because in some cases, that's the only smiling face, nice person
Exactly.
that person's going to
Yes.
see.
Yes.
And so if that's the one thing, we all have talents, but if that's the one thing that we can do is to be nice to people, it gets them connected.
Yes. And
And I get
What
excited
would
about
you
it.
say, Beth, to someone listening who, even after everything you've said, is just so hesitant to make that call?
I say pick up the phone and call. I said, see if we're the right place for you.
Right.
Some people,
You're not committed. Once
No.
you call, you can go in, have a meeting.
yeah, we'll do an intake, and we say intake, we screen people, especially if they're uninsured. But if you have insurance, you get kind of bypass it. Although I do like it when people do go through that because they understand better what we do. But
Mhm.
you can come in, you'll see a provider, and especially if it's a mental health or addictions issue, we have other people to help them. They can bring in that day the behavioral health person,
Oh, wow.
literally to do a brief intervention
Right.
and work with them and stuff. So you don't have to wait. And then for the addiction services, we've really worked on two aspects, and we've been very lucky. We've started with medication-assisted treatment. So we'll do Suboxone and Vivitrol. And depending, we have staff that's trained on that and also trained on how to support them. And we've also was blessed, 4 years now, the state came to us. I had gone down the state before COVID and said, "We're doing all this." We started MAT, and I never forget, Dr. Sullivan was the head of FSSA, and I said, "There needs to be more And she goes, yep, I got more for you. They called us and we started this mobile integrated response team.
Yes.
And that's the one that you did with Ellen. And so what that is we have peer recovery coaches that have got lived experience.
Yes.
They're going through addictions. They've gone through it, or they're still always going through it. And so recovery, and they're there to help. And so we have stories, if someone needs help finding an apartment, because sometimes if it's really, we can work on that and we can help with that. We can help with food. We can help. My other one that I'm very, very proud of is we have what's called a medical legal partnership. And so what that is, that we have a partnership with Indiana Legal Services, and we have a full-time attorney. And you're like, it's everything that's not criminal. So we've seen, people that are being abused and living in something, and they're being told, well, you're not going to get the kids by the spouse if you leave. We can help get restraining orders. That's what they do. To things, we help, if we have someone who's in recovery and they've lost their driver's license, or they can't see their kids, they're never going to get through this unless we can find a way for them to go to work or go visit that kid. So we have a full-time attorney, Sarah, and so she works with them all the way to one thing that's really come up lately is wills and advance directives. And so she's been working on that, and we're going to start more of that for the seniors, helping them understand that.
That is so amazing. So what you're saying too is it's just not health, but we know that health is bigger than just going to the doctor.
It's all the social determinants.
That you have the resources there. That is like kind of a one-stop shop. Just call us if you have a concern. We'll point you in the right direction. And if we can't provide it here, we might know someone that does.
Yeah, and we will send people out. I mean, if we really can't, we're going to let them know. Because we want them to get the care that they need in the place they need it. So
Beth, that is wonderful. Anything else?
The only other thing I want to talk about is so we've been right kind of across the street here, and so during COVID, we really thought there was going to be a Build Back Better funding, and so we started looking at this building. We've outgrown it. And, when we moved downtown, nothing was here. And so I remember asking, I had to go see Mayor Oberly, and I said, can I put something there? And he goes, absolutely. So, and we're also struggling with workforce. So I was actually talking to the chancellor of Michigan City and Otso Sikowski, and I said, Otso, what can we do together? And so they sold us some of their property here in Michigan City, right on Franklin. And we have started building our own building. There was no Build Back Better, but we're working on trying to get all the funding for it. But we will be building it's going to be about 35 exam rooms. It's going to have a cooking. One thing I've always wanted is a cooking kitchen to try to do some training, because we have healthy foods, and we also have a food as medicine grant, that will help us do more on that. But we hope to be about a year from now, they will be moving in. So I'm really excited about that. So
that's great.
It's good. It served more people, and it's still on the bus route, and I'm excited about it. So that was my last thing I was pushing about.
What great partnerships. And just, I think people just don't always see the bigger picture, especially when they're in the situation. I know when we were in the situation, it's like, where do we go? Who we're going to go to? And, where the yellow pages back in the day, it's like, where can we go and we can feel safe, and we don't have to go from this place to this place to that place. And, I think, HealthLink. And we were one of those that came and got a vaccine there when, the COVID 3-4 times. Outstanding service.
Oh, thank you.
Yes, absolutely.
I love my staff. They're amazing.
I'm barely in the door. Like it's the door opening, and can I help you? And so it's just.
We want to make sure, because once they come in, we want to keep them.
Yep.
Wow.
So
I want to. We want to thank you for your service all these years, because it is not easy, and navigating all those things, staff, the government, funding. What are the needs of the community, and you're a great outreach person. So thank you.
Oh, well, thank you
for all that you've done.
It's been my mission and my pleasure to do it. So
And
thank you.
thank you to HealthLink. And if you have any questions, our websites will be online that
Yes.
you can reach. And as far as
The contact information.
contacting Lisa on her book, or contacting me for coaching, and contacting Beth and HealthLink. So thank you, Cassie. Thank you always for being here, a woman behind the scenes making this all work. And we wish you a really, really good week, everyone. And as we always say, just as Beth's theme and HealthLink's theme is being kind. You know, it goes a long way. And when any of us are in a troubled spot, being kind really works. So be kind to yourself, be kind to others, and have a good week. Thank you.
If you enjoyed today's episode, let us know by leaving a comment or review and sharing with a friend. All resources mentioned today and a full transcript of this episode can be found by going to our website, www.healingwithconnection.com. A video of this recording can be found on our YouTube channel, and the audio podcast is available on Spotify, Apple, and Google Podcasts.